There was a day when I feel very exhausted, but I don't want to give up hope because I have to be strong for him.
We have this saying, in Islamic perspective, right? The best of you are the one that benefit other people.
It's a privilege that you are healthy enough to take care of somebody else.
There isn't any word of tiring or tired in my dictionary at that point of time. My only concern is for his recovery journey.
You must be ready for hard work. I don't mean 1 day, 2 days. Whenever he needs you, you have to be there. For me, I don't find it's a sacrifice.
In the early stages, my mom was diagnosed with osteoarthritis, in which she was having a knee problem, and then subsequently also she had callus or corn below her feet, so it's quite painful for her to walk with it. So my mom's feet actually requires proper footwear, so we have to try a lot of shoes to fit my mom's leg actually, because she need to feel comfortable to walk around, especially going to the medical appointments or that. It was an endless trial of shoes actually. When she wore like 1 or 2 days, it's not comfortable. So we changed another shoe. 1 or 2 days, not comfortable again. Till I told the nurses that actually we can open a shoe shop actually.
Selesa lah, bawa tapak kaki sakit. Di tempat yang kurang yang gelembung tu sakit. Tapi yang ini selesa.
I was holding a full-time job, but I realized that after a certain time, it's quite difficult for me to open a schedule. Hence, I decided to resign my full-time job. As for now, actually, I'm having a hawker stall. Every week, the stall is open from Thursday to Sunday. Monday, Tuesday, Wednesday is our off days. But during our off days, Monday is meant for my mom, and Wednesday is meant for my mom-in-law for their medical appointments. But the thing is, you just try your best, and whatever result outcome it is, you won't ever feel regret because you give your all in.
The X-ray images of her lungs that time, they showed that they saw a lot of cloudy, opaque shadows, all those things, not the clear lungs that you see on a healthy individual. Her condition, her genetic mutation is a rare one. I mean, I've seen the time where she's so helpless. She has to be helped to walk to the toilet. She needs to have a special chair so that she can sit down, and that few hospitalization, so-called near-death experience where her blood oxygen really plummeted to a very dangerous level. I mean, everybody can say a marriage vow when you're fit and healthy, and no worries. For me, it's like there's a commitment there that our marriage vow, in death do us part. And I think at this stage of life, you have to realize this, so that yes, you are living life with a purpose, a meaning, and there should be a sense of fulfillment and gratitude, making people happy, making people well, and that they're able to carry on with their lives. You give them hope actually. The love that you show them, you give them hope. So it's important.
I went to the washroom, and my son was shouting to me, "Hey mom, I think there's something wrong with that, the face, one side came down, and then they sent him to NUHS. And he stayed there for, I think, 2 weeks or more. They already found out that he's got this Parkinson and must take the medication. Well, the tough part is, looking after is tough, it's not easy. It's just like looking after a sick person, who cannot tell you what's wrong, So you just go to the bedside and feed him with something, and then try to talk to him for a while before he go back. And we feel that his mood is up, better, and he feels happier, talking to, knows that we are around, the family is around or something. The joy comes to see that he's not getting more seriously ill.
So there's one instant where, because he was sedated, when he's awake, the first thing that he wanted to know is his condition. He managed to move his hand, showing towards his abdomen. Couldn't able to speak so much because all the while he was wired up, which at first I do not know exactly what is he trying to say. There is a paper here whereby I managed to pass him a pen, so he managed also to just write something. I just write him to let him know that he is okay. You are okay, and ask him to rest and relax. That's the only message that I want to let him know, that he's fine. I'm just happy that I can still see him alive. That's the most important thing that I remember on that point of time. I just want him to be alive. The rest of it are all secondary to me. So yes, the wires on him started off, there's all kinds of wires, from the plug here, from the plug on his hands, from the mouth, from the nose to the nose and all that. This is what I can share, that he start off with just 30 ml of fluid water. I've been keeping these small cups in the ward because this is the only 60 ml that he's able to drink for a start. Each month there is progress whereby the doctor able to unplug whatever that is into him. So I feel good, I feel happy.
Very thankful to my wife because she really take care of me no matter how bad my condition is. As a wife, I really appreciate it.
My husband was diagnosed last year with Alzheimer and CJD. Creutzfeldt disease is a very rare and fatal brain disorder, and there's no cure. For CJD, they are not able to talk, but I think they still can hear what you talk. So usually, when I feeding him or I clean him, I usually will make conversation with him. Even I know there's no response, but I do believe that he will listen to what I said. So I will still continue to talk to him. To be honest, it's not easy to take care of a sick person, but because he's my husband and I love him so much, and whatever I do with all love. In January, we were invited by NUHS to go for Hajj in June. So I determined to bring him along, even though I know it's not easy to bring him, because we have been waiting for the past 12 years, and I know this is what he wished for, even though he's not able to talk anymore. I put up courage to bring him along, even though I know it's not going to be easy despite the hot weather there. But Hajj journey actually is a sacrifice. And I pray to God to ease the journey while I was there, and Alhamdulillah, we able to complete it. Yeah. What motivated me to bring him actually is his kindness and love that I cannot repay back. To my husband Azhar, I know it's difficult for you to be into this condition, but please remember that I always be by your side and I always take care of you. I will never leave you, no matter what it takes. I do love you, and I hope you can remember that.
You really have to realize that commitment, that whole vow that's not taken lightly. Yeah. So burden, surely there is, but it's a healthy burden that I would gladly accept.
I don't mind sacrificing all those, not going out with friends and all that, because I find that it's okay lah, Looking after him is quite joyful.
He's a good man. He's a good husband. He's a good father to my children. I'm very blessed that I'm able to carry out my duty, especially as a wife, towards a husband. And I couldn't be more thankful to Allah that saved his life.
There's nothing, right, that I wouldn't do in this world for her. It's never enough to repay her kindness to us. Never enough, compared to what she did for us.
I know that caregiving is not easy, and looking at the way that he treated me when he was healthy, I think it's time for me to pay back him for all the love that he has given me so far.